We're going to turn now to the drug Primodos and claims coming out of the UK that it was responsible for an unknown number of birth defects in the 1960s and 1970s. Now, this is being strongly reported in the UK, but Bayer, the German pharmaceutical company that owns Schering, who manufactured the drug, emphatically denies the claim. Much is in dispute. But Checkpoint has learned that the drug was prescribed in New Zealand and was withdrawn here in 1975. Interestingly, that's 3 years before it was withdrawn in the UK. An article from the New Zealand Herald in June 1975 refers to an increasing amount of evidence linking it with birth defects. A man called Dr. D.A. Andrews from the Health Department is quoted as saying there had been quite a number of reports associating the use of pregnancy testing drugs. These are drugs you took to find out if you were pregnant with fetal abnormalities. Now, that was 42 years ago. But now a Sky News investigation has reasserted those links. And a group action is underway led by the Association for Children Damaged by Hormone Pregnancy Tests. This morning, very late in England, very late on Sunday night in England, we managed to get hold of its chairperson, Marie Lyon, before she went to bed. She says it took years for her to realise Primodos may have been the reason that her daughter Sarah was born in 1970 with part of a limb missing.
At the time, we were told that these things happened, so you get on with things. And it was only when she was 8 years of age that I found out that it was to do with the tablets that the doctor gave me to find out if I was pregnant. So that was quite a shock. I agreed to join the association that was trying to fight to find the truth about these drugs, and that was in 1978. We then had litigation in 82, but unfortunately, because of the might of the drug company and the fact that our experts suddenly started to kind of, be sponsored by Schering or find another job that they couldn't actually appear, we had to actually stop the litigation. So it was only back in 2009 that we restarted the organisation. And then in 2012, I agreed to become chair. So that's kind of a timeline of what happened.
And I'm just reading the Robert Booth article in The Guardian. It seems from that article anyway that the breakthrough was your discovery of 31 files of documents about the drug in a state archive in Berlin. What did you find?
Yes. Wow, it was a revelation because there were letters in there from Schering's lawyers, and the lawyers were basically asked the question, do you think we'll be found guilty? And the answer was yes. Why would we be found guilty? Because you hadn't done enough. You were aware that there were problems with the original testing. So that was quite a shock. It was also a shock to find out that initially the drug had been manufactured as an abortifacient, and yet they were using that as a pregnancy test.
Can I interrupt there? Because when it was described to me, it sounded incredibly like the morning after pill. How did it tell you you were pregnant? What did it do?
This is what we've never understood. All that we were told was that the hormones, this was later, remember, when we actually took the tablets, we were never given any information. We were just told it was a test, it wasn't therapy, and it would be a quicker way to find out if you were pregnant. So the initial thing when we finally found out that the components were 40 times the strength of an oral contraceptive, our first question was, well, how on earth can that work? Because the contraceptive stops you being pregnant. And we were told that the increase in hormones, if you weren't pregnant, would then bring on a period. If you were pregnant, it would not harm the baby. They were quite adamant on that.
And in fact, one of the documents that I think you discovered, Sky is reporting this, and I quote, says, no toxicology had been carried out before introduction either in Germany or the UK?
Perfectly correct.
So they were giving you something which sounds, on the face of it, incredibly like the morning after pill. It induces...
It does indeed, yes.
And there had been no toxicology work to understand the extent of its impact on the fetus?
None. Incredible, isn't it?
It boggles my mind. And yet there is still... And look, this is meant to be a dispassionate interview, so I'm going to rein myself in here, but... The drug company itself still denies the cause and effect.
Of course they do. Of course they do. They have to do because they've denied this now for more than 40 years. And the reason that they initially denied it was because the same components are in the oral contraceptive pill. Now, the oral contraceptive pool was having massive problems around the 66, 67 time. And, of course, to then, let the public find out that there was another drug on the market that could also cause problems would have got women to stop taking the oral contraceptive. They couldn't afford to do that. That was the biggest selling tablet that they had. And it was Shearing's that produced the oral contraceptive and Shearing's that produced Primodos.
Okay.
So it's so closely linked.
Okay. And, of course, some people listening to this are going to say conspiracy theory. In that cache of documents that you found, all those documents you found in Berlin, were there documents? Is there material to substantiate your theory that, in fact, they were preserving brand reputation?
Absolutely, yes. Absolutely. It's quite apparent in the text of the letters, in the way that they try to defend through their solicitor, in the fact that they actually colluded with the Government Health Agency in the UK and with the Government Health Agency in Germany. Now, Germany, the Government Health Agency was called the BGA, and they actually are on record as saying, we are advocates for Shearing. Can you please send us documents that do not show abnormalities when using Primodos?
Who gave it to you? Your GP gave it to you. Did he or she?
He.
Okay. And so did you simply want to know if you were pregnant?
Well, yes. I mean, I just expected a urine test. My feeling is that GPs, you see, they were given 25,000 samples, and they were incentivised to give those samples out. Now,
hold on a sec. Do you know that? So they were incentivised in what way?
Well, each time that they gave out some of the tablets, they were incentivised with a reward, either remunerated through money or, as you know, with the pharmaceutical companies, they still remunerate today for certain drugs.
Okay, so in the normal course of events, and I think many of our listeners will know this, if you want to find out you're pregnant, you take it, you just pee on that little strip thing, right?
You do.
Okay,
yes.
But your GP gave you this new drug. Did he tell you that there were risks? Did he tell you what it was?
No, didn't even explain what they were. Just said this is the way that you find out if you're pregnant. It was my first pregnancy, so I genuinely would not have had an idea whether that was right or not.
And this is also at the same time or just after thalidomide, right?
That's what makes it even worse, because thalidomide was a therapeutic tablet for morning sickness. There was a purpose, even though it obviously was the wrong thing to give to women. There was a purpose to it. With Primodos, it was purely a test. It made money, a lot of money. It saved doctors' time, saved the government expense, because they didn't have to go through, the frog thing where you had to go inject the liquid and then go back and see your doctor. So it was obviously very cost-effective for the government and made a lot of money for the drug company.
So what happens now? Because you are in dispute with a big pharmaceutical company, and they will have a legal team the size of a small country, right? Where do you go to from here?
Well, they might have that legal team, but I feel that we've got right on our side. And, my feeling is that the facts we have are indisputable. Now, they will fight, and I know that because they fought hard in 1982, and I believe they spent about £1.5 million on their defence. We had legal aid, so you can just imagine the difference. But, they're prepared to fight because they're prepared not to have to admit that they actually went to the lengths that they went to actually cover this up. Okay.
Your association, do you have members in New Zealand? Have you heard from anyone in New Zealand?
No, we haven't. And I think, again, the horrible thing is that since this has started to become more in the public domain, we've had so many women ringing through to say, oh, my goodness, this happened to me and I thought it was my fault. And I think with New Zealand, again, unfortunately, there was a huge sales team in every country. And again, it could be that, these things were suppressed even in New Zealand because there is no way that your government, health authorities, would have, as is quoted, forced Shearing to take it off the market unless there was some sort of evidence that people in your country had also been affected. Now remember, it can also cause miscarriages and stillbirths. So many, many women will have thought that they just, very unhappily either miscarried or the baby was stillborn and there's no explanation.
Maria Lone, who took Primodos whilst she was pregnant and as part of a class action against the drug company Bayer, who strongly and emphatically deny cause and effect. MedSafe declined all requests for an interview today. Its manager, Chris James, says they are working through archives to establish its use. We've sent a list of questions to Bayer regarding the use of drugs and the sale dates in New Zealand. It's yet to get back to us. But a short time ago, MedSafe's manager, Chris James, gave us this statement. Primodos first appeared in New Ethicals in 1969, suggesting it was available and prescribed in New Zealand from that time. In May 1975, the then Department of Health issued a clinical services letter advising that it was withdrawing systemic hormonal testing preparations for pregnancy testing from the New Zealand market. It did not specifically identify Primodos. There's no information on how many patients were prescribed this product. MedSafe has contacted Bayer to obtain information if it's available. Checkpoint has also asked Bayer for the same information. If you think that you took Primodos in the late 60s or early 70s, we'd really love to hear from you. Text us 2101. Email checkpoint@radionz.co.nz.